Good afternoon, everybody, and welcome to the March 19th meeting of the San Dimas Rotary Club. My name is Steve Scott. I am the president of the club. I have been a Rotarian now for about 15 years, and I am a State Farm agent in the city of San Dimas. Let's go around the room and give everybody a chance to introduce themselves. Raymond, I never start with you, so let's start with you today. How are you?
Absolutely fabulous, Steve. Raymond Foster, immediate past president, current secretary.
Thanks for being here. Hi,
Well,
Sylvia. How's everything going today?
Hi, it's going great. My name is Sylvia. I'm with the San Dimas Chamber of Commerce. I'm the CEO here. Thank you so much for joining us.
Excellent. Thanks very much, Sylvia. Hi, Ellie. How are you?
I'm very well, Steve. How are you?
Doing fantastic. Thank you.
Happy to be here. Elizabeth Sachs, retired LA County Sheriff's Department and new Rotarian.
Excellent. And Marianne Kistler, how are things today? You have to unmute yourself. All right, we'll move on from Marianne.
Okay.
She can. Oh,
No.
there she is.
Okay. Marianne Kistler. I've been in Rotary for over 30 years, and I am the current foundation chair.
Thanks for being here, Marianne.
Thank you.
Hi, Margarita.
Hi, sorry. Margarita McGee, local estate planning attorney here in San Dimas.
Awesome. Thank you. And Anthony Porter, how are you today?
I'm good here at work. No camera, sorry. Uh, Rotarian, I don't know, maybe a little over a year. Satellite Rotary, current president of Laverne San Dimas Educational Foundation.
Excellent. Well, thank you again for everybody who is here, and hopefully we'll have a couple more coming through shortly. Let's move on to our speaker. Today, I'm very happy to introduce Linda Loera. Linda is the Program and Education Manager for the Southland Chapter of the Alzheimer's Association. The Alzheimer's Association leads the way in accelerating global research, supporting those living with dementia, and advocating for policy change to enhance care and resources. Their extensive programs include 24/7 helplines, educational opportunities, support groups, clinical consultants, and vital services like Medicalert Wandering Support. Additionally, the association's commitment to research and advocacy ensures continued progress towards treatment, prevention, and ultimately a cure. This hits very close to home for me, Linda, so I am very much looking forward to your presentation. It is all yours. Take it away.
Thank you so much, Stephen. Thank you to Raymond for setting all this up. I really appreciate the time that I have to spend here with you and talk to you a little bit about Alzheimer's disease, the programs and services that we offer in order to support the communities within our chapter. So I'm going to go ahead and share my screen. All right, it worked the last time we did it, so hopefully it works now. Perfect. Let's see, hide that. And let's go to presentation. Let's show the Perfect. So a little bit of information about myself. My name is Linda Loera, and I am one of the program and education managers out of our chapter, which is the California Southland Chapter. So we are part of a national nonprofit organization, the Alzheimer's Association, and our chapter is responsible for serving 7 counties, actually. LA, Inland Empire, so both San Bernardino and Riverside. We also cover Kern County up with Bakersfield, Inyo, Tulare, and Kings County. So a huge area. I specifically am part of our care and support team here out of our LA office. And most of the work that I do is in the San Gabriel Valley area, but we're a very complementary team here with the rest of my colleagues. So we go wherever we are needed, but most of my focus is San Gabriel Valley, downtown area, Northeast LA. So if you ever have any questions or need anything and you're in this part of town, you will be coming to me. If you need information for a different part of our service area, just let me know and I can connect you to the right person. So as Steve said, we do provide a lot of programs and services. I'll get into that a little bit later. But we all like to talk a little bit about, the disease itself, just some basic knowledge, some basic information, because there is a lot of misunderstanding about the disease. There's still stigma around it. And so a lot of people aren't quite sure what it is, what it isn't. And so we like to start with some basic information, some facts and figures. So let me see here. Is it going to work for me? Yes. So a little bit more about the organization itself. We like to think of ourselves as leading the way to end Alzheimer's and all other dementia through various pillars of the work that we do. We do a lot of global research. We are also driving risk reduction and early detection out in communities. And while folks are going through a dementia journey, we do want to make sure that we're maximizing quality care and support for them. As you can see here, our Alzheimer's logo is this little thing here. A lot of people aren't quite sure what it is. Well, the symbol represents the abstract forms of a human head for the work that we do, and the beaker, right? So we are about people, right? Providing that support, those services, that information that they need about the disease, caregiving, the impact it has on families, communities, even our programs and government programs and healthcare facilities and all of that. That it encompasses, but also the science behind our cause through that research work that we do on a global scale. So as I mentioned, I'm one of the program managers under our care and support. And so this is really the pillar of the department that is in charge of providing the supportive programs and services out in the community. So we are responsible for doing the community education work, as I am doing here today with you all, but also responsible for providing the support groups for caregivers, the care consultations that we do with families, caregivers, individuals who may have gotten a diagnosis to, just guide them through what this process looks like in terms of getting diagnosed, or the programs and services that they may need and getting them connected to them. We are also responsible for early stage disease programs. So some programming for folks who have been diagnosed and are still in the early stages and can participate in some socialization programs. So really our work is about the people, right? We are connecting with a lot of community organizations to make sure that we are, in the know of what is being provided out in communities. And again, connecting folks who need those services to them as well. We also do a lot of advocacy work through some staff teams, but also through a lot of our volunteers. We need to be telling our stories. And I always say, well, as an organization, we can say this all the time and make those meetings, to DC and our Sacramento, and tell our representatives how important it is to, have funding for the research and for programs and all of that. But it is even more impactful when it comes from their own constituents, right? People who are saying, hey, I've been impacted by this disease, whether it's because I have it or somebody in my family has it, or I'm a caregiver, and we need, the funds for all of these things, right? To support the caregivers, to support the families, to support those with a diagnosis. And when we have those volunteers telling their stories, then, our representatives will pay more attention, right? Because these are the folks that are either, voting them into office or not, right? And so they need to hear what is important for their constituents. So we're always looking for folks to help us with that part of the work that we do. Education and awareness. We talk about, how can people, want to learn more about the disease if they don't know that, we're around to provide that, right? All of our programs and services are free, but they don't know who to look for or what to look for. So we do a lot of awareness presentations like the one I'm doing now, so that folks know that, hey, maybe right now I don't need this, these programs and services, but what if I do in the future? Or what if my neighbor or my friend is in need of these? Now I know, I am aware, and now I can pass on the word about, who they can go to for this kind of support. Talked about research. We don't know where that cure is going to come from. We don't know, who is going to come up with that special mix mix of, prevention techniques. And so we are, funding research worldwide to support all the scientists, all those folks who are working to find that cure and those prevention techniques so that we can bring them to the world, really. And then, of course, unfortunately, while this disease does not discriminate and it can affect everybody and anybody, there are certain groups who are being more affected by this disease, and they fall into a lot of the work that we do under our diversity, equity, and inclusion work, really focusing on communities who have a much bigger impact because of the disease. So this is really what the association is about, and all the work that we do to hopefully, like our mission says, bring an end to Alzheimer's and all other dementia. Now, every year, the association puts together a facts and figures report. And it's coming soon. It is released in March, so we will see it anytime soon in the next couple of weeks, probably. These are facts from last year. They don't tend to change too drastically, but every year we do also, aside from our facts and figures, have a special report. So our team in our headquarters, our medical science team, will choose an area or a specific theme, subject that is of relevance and importance to us now, and really do a deep dive. And so we don't know what that is yet. We will find out soon, though. But for last year's facts and figures, we do know that this disease impacts nearly 7 million Americans. And those are the ones that have been diagnosed, right? Who knows how many more are out there who don't actually have a diagnosis. We also do know that 1 in 3 seniors dies with Alzheimer's or another type of dementia. And we've been working really hard to get, folks who work in our healthcare system, to put that as the reason of death, right? For a long time, it just hasn't been pushed. And so they'll, jot down that the person died of, something else like pneumonia or some kind of, liver failure, whatever. But if at the end of the day that was caused because of Alzheimer's, then we need to know that it was because of Alzheimer's, right? And so not only do living Americans, are affected by this, then also caregivers are affected by it, because there is a whole team, a whole community that is helping them through this disease, whether it's direct caregiving or supporting those caregivers as well. People that may live with them in the same household, even if they're not direct caregivers, friends, neighbors. But there are about over 11 million caregivers who are caring for somebody with some type of dementia. So a lot of people are being impacted by this disease, not just those with a diagnosis. One of the other things that we're working really hard on is, that awareness, right, about the disease. While we have done a really great job with heart disease, right, there's been many, many campaigns talking about a healthy heart. And we see it in our data. Deaths between 2000 and 2021 decreased from heart disease, decreased 2.1%, while deaths from Alzheimer's disease increased 141%. So getting the word out about this disease, right? And really pushing that research to find, what are those preventative things that we can be doing to hopefully reduce our risk for developing this disease, or preventing it over. So a lot of work is being done on that. And then I also mentioned the fact that there are certain communities that are impacted by this disease more than others. And so we see that in older Black Americans or African Americans, they are more like twice as likely to have Alzheimer's or other types of dementia than whites. And in the Latino community, it's 1.5 times more likely that they'll develop this disease. We don't completely understand why, but we do know that there are certain chronic conditions that are increasing the risk of an individual developing Alzheimer's or another type of dementia later on. And those numbers tend to be higher in these communities. Things like high cholesterol, obesity, diabetes, cardiovascular problems, all of that, those numbers tend to be higher in these communities. And we do see a connection between these conditions and the higher risk for developing a type of dementia. So again, more research is being done to completely understand this. Hopefully at one point we will, and will help us in that road to preventing this disease. Now, what is dementia? What's Alzheimer's? It's the same thing. Is it a variation of the same thing, right? We do get a lot of questions because there is still a lot of confusion out there. And so we just like to go over this slide quickly just so that folks have a basic understanding of what it is. And so dementia is they call it an umbrella term. It's the little umbrella here. Just really to talk about things like loss of memory, right? There is going to, when somebody's having a difficult time with processing information, and having these changes, right? And maybe even personality. And that's really what dementia is used for. It's just to refer to these to these changes, right? And most of the time it's that loss of short-term memory, one of those symptoms that we see the most or the earliest in a person, but they need to be severe enough to interfere with daily life, right? It's not your typical I lost my phone, right? We all lose our phone multiple times a day, right? It's nothing new, right? And it's not because somebody has dementia, it's just because we're carrying it around, we leave it everywhere, we're doing 20 things at the same time, we just can't keep track of it, right? Same thing happens with our wallets, our keys, things like that. Here, what I'm talking about is, loss of memory, massive confusion, loss of the ability to kind of retrace steps to find things, to the point where people are not remembering to take medications or are taking too many, right? They forgot they took it again. They lose the ability to kind of organize their day. What do I have to do today? So they keep missing, their appointments. Maybe they're having a hard time cooking for themselves and doing their grocery shopping, right? So these are things that are severe enough to interfere with that daily life, things that they were able to do in the past all on their own. Now they're needing assistance, to get them done. Now, all of these changes, don't necessarily mean it's a type of dementia. Somebody could have short-term memory loss because, say, a severe stress, right? Or depression, something like that. But when we take a look at all of the symptoms over time, right, it could indicate that there is some type of dementia. Now, what type is it? Well, only a doctor can tell us that. Alzheimer's is the most common type of dementia, but it's not the only one. There's vascular dementia, Lewy body dementia, frontotemporal dementia, and others, including Huntington's, Parkinson's, that type of neurological diseases that could bring dementia along with it. And then there's also mixed dementia where somebody could have more than one type of dementia. That's not unheard of either. Now, the reason why I especially like to stress, the importance of knowing what type of dementia a person has is because there have been medications that have been FDA approved in the last, 3-4 years that are specifically for Alzheimer's, where they can slow down the progression of the disease, but they are approved only for Alzheimer's in the early stages. So in the past, there have been medications approved, but those medications were really just designed to help with the symptoms, right? With the confusion, maybe with the aggression, with the anxiety. Maybe they help a little bit with some of that memory loss, right? But they didn't actually do anything to stop or slow down the progression of the disease. These newer medications actually can slow down the progression of the disease, but again, only for those who have Alzheimer's in the early stages. And so when somebody goes to the doctor, and I hear this all the time, they'll say, well, my mom was diagnosed with dementia. And I said, well, what type of dementia? And they're like, well, I don't know. right? They're never told for some reason. I'm not sure if it's because the provider they're seeing doesn't have the tools and knowledge to narrow it down, or if for whatever reason they're just simply not told, or it just, sort of not even asked, right? Because a lot of times we don't even know what to ask. So now I really, really stress the importance of asking for an exact diagnosis because it can be done. There are tools, there is information out there for providers to be able to do that. Now, not every provider may be able to do it, but there are those who can. And so if I was, if I had told somebody, you have cancer, we wouldn't leave it at that, right? You would want to know what type because that's going to dictate what your diagnosis, prognosis, treatment is going to look like. It's the same for dementia. We don't want to leave it just at dementia. We want to know what type it is so that we know what is available to us and what to expect from the progression of this disease. Okay, so again, dementia is not disease. It's really just a term used to explain the changes that we're seeing in somebody, like loss of memory. And what we really need to know is what is causing those changes, what dementia is impacting that person to the point where we're seeing these changes in them. Any questions on this? Well, I guess we'll leave the questions at the end, but hopefully this is clear. If not, I can go over it again during our Q&A. Now, what can we do to maintain a healthy brain, right? So I mentioned that we don't yet know how to prevent this progressive brain disease that is eventually fatal. But science is showing us that these healthy behaviors that I'm going to go over can impact our brain health and potentially reduce developing this disease, right? So one of the ones that we see over and over again when research is done is that physical activity is super important. If we sort of know all these things, right? We know that we're supposed to exercise. We know that we're supposed to eat healthy, don't smoke, protect your head, sleep your 8 hours, all of that. But when we really think about it, is we have to think about what does the physical activity really do for us, right? It's going to make sure that our heart is healthy, right? It's strong, right? But then the connection between the heart and the brain is very important because every time our healthy heart pumps blood to our brain, we're getting the oxygen, the nutrients that it needs to maintain itself healthy as well. So if our heart is not working because we're not physically moving, we're not strengthening it, then that means that the healthy oxygen that we need may not be getting to our brain the same way that it would if it was stronger, right? If we have clogged arteries, well, then that blood is not flowing the way it needs to. So physical activity is very important. Healthy diet as well. Again, nothing out of this world that you haven't already heard, right? But we also need to know that whatever we're putting in our bodies, what is ending up in our brain, right? We see all kinds of stuff out there about the good and the bad. Let's focus on the good, right? Let's have that Mediterranean type of diet where we're eating all that healthy stuff and not clogging our arteries, not, ending up with diabetes, chronic conditions that again, doesn't mean you're going to get Alzheimer's because you have diabetes, but your risk could increase, right? So good night's sleep. Again, we all know that we need to do it because we need to rest. But what often doesn't get talked about is the fact that not only are we resting, but the brain is also going through kind of like a reboot at nighttime, right? When we go into that deep sleep is when our brain is sort of going through that day's information, right? So think about it as a little computer, and it's going through all the things that we've done, experienced, learned, done, smelled, heard, right? And it's getting rid of all the things that we, really don't need to know, right? Do I really need to know that, there was a dog walking down the street? Probably not, right? We can get rid of that information. But do I need to know that, hey, I did, tomorrow or today I did a presentation and then I'm going to need to follow with certain people? Yeah, it's information I need to keep, right? So your brain goes through this process. It also gets rid of certain, junk that we have in our brain, certain proteins. So it does a couple of things, but if we're not sleeping long enough and we're not entering that deep sleep, then our brain doesn't get to do that, right? And we know it, right? The next day, if we haven't slept well, we don't feel good. We also can't concentrate. We also can't remember things, right? So again, it's not just, get 8 hours of sleep because you need to rest. It's for your brain to do all this extra work that it needs to get through to, again, maintain that brain health. Of course, don't smoke. We all know this. Protect your head. If you have, major head trauma, that could increase your risk of developing this disease. We see it every so often. And, football players is one example that I like to give because every so often we'll hear about, the issues that they have. And then obviously I already talked about the importance of heart health as well. So again, these things we don't know how much of it, which ones, which exact recipe will help us prevent, the disease. We don't know that yet. Hopefully, the science will teach us in the near future what we need to be doing. But science is showing us that these things do make a difference. And people who follow these kind of healthy habits over time do tend to, if they get the disease, get it later. Right. So there are things that we can be doing now to maintain our brain health that could have a long-term impact later on in our risk reduction. Now we need to reach all communities. Again, there are certain communities that are being impacted more than others. We need to focus a lot of work there, but really all communities, because this, again, disease does not discriminate. There are certain things that we can be doing to protect it, to reduce our risk. But at the end of the day, we could be doing so many things correctly and still get the disease, unfortunately. So again, that hard work to find that cure for those who do end up with that diagnosis. So more of that research that we are doing on a world scale, right? So the Alzheimer's Association is the world's largest nonprofit funder of Alzheimer's and dementia research. So we're not counting the US government and the Chinese government, who are the two largest funders of Alzheimer's and dementia research. But we're the number one nonprofit. So currently we do have about $430 million in research on over 1,000 projects in 56 countries. Again, we don't know who's going to discover that cure, but we are working in a very collaborative manner through various projects that the association has, and collaborations and clinical research that is being, shared worldwide, so that hopefully by working all together, we'll get to that cure sooner rather than later. Now, we can't make this investment without the funds, right? We need the funds. And so every year we do have our walk, and that's how we are able to get this money out into the world, the science world. And if we want to talk about research more locally here in California, we happen to be just very lucky in the sense that we do have a lot of institutions, whether they be, hospitals like Cedars-Sinai, but also universities like UCLA, who are actively funding a lot of that research. And we are, they're not funding it. We're funding them to do that research, right, at that local level. So actively, right now, we have about $66 million statewide in 128 awards, dealing with all angles of research, right? Some folks are working with mice and some folks are working with humans, right? And it's a huge range of research that is happening in all these different institutions. And we're very happy to fund them. And being here in LA, I'm just really glad that all of this work is happening here locally, because a lot of times we're able to take advantage of those clinical studies. People can volunteer, and it's possible because they do live here locally. So just keep that in mind as well. Now, how can we be of help? So if somebody does have a diagnosis, a caregiver is, caring for their loved one with this disease, they do need a lot of support. And so my go-to is our 24/7 helpline. This helpline is available every single day. We do not close. Most of the workers are out of our Chicago office, but we do have some remote workers too answering those calls. And we do have specialists, master's level clinicians who can offer confidential support, information, connecting people to classes, to support groups, to community resources. They have staff who speak English and Spanish, and for all other languages, we do use a translation service. So language should not be a barrier. It's free, obviously. I always tell people, even I, use this number, right? Because sometimes I get a little bit stuck. I say, I'm working with a family and they've tried everything that I know of, but our helpline receives so many calls, they probably have other ideas. So always feel free to reach out to them, especially if you're not quite sure where to get information that you're looking for. They'll guide you, right? So we do have a lot of free educational classes. They're pre-recorded, can be viewed at any time, but then we can also come to you and do a live presentation like I am doing now on various topics from basic, 10 warning signs class to all the way to our series of classes for caregivers. So we have various different topics. Email me, contact me. I'll put my info in the chat if you want me to come talk to your staff, to your clients, to your, patients, wherever you work, to your community. If you're part of a PTA and want a presentation, please just feel free to reach. There are folks in all walks of life having to deal with this disease in one way or another. So we are happy to present for everybody and anybody who's interested in learning more about it. We have other resources as well. We have our community resource finder, where if you're looking for a doctor, a neurologist, or if you're looking for, that's called home health agency, things like that. You can go on there and punch in your zip code and it'll give you a list of resources in your area. So we do have this and many more online tools as well, like blogs and calendars and a bunch of things that are very helpful tools for caregivers especially. So please go on our website, alz.org, and you can find even more information. So here, how can you help us fight Alzheimer's disease? As an individual sharing your story, right? Become a volunteer with us. We're always looking for individuals who can help us, meet our goals, which is bring awareness, bring information, education, support families through caregiver support groups. We have volunteer opportunities for many different, folks who want to get involved. Pass along the information. If your neighbor mentions that, hey, they got a diagnosis, let them know, hey, Alzheimer's Association, give them a call, right? You can also get involved in clinical trials. We have a website called Trial Match. It's just kind of like a database of all the various clinical trials that are available. You put in a basic information about yourself and they'll connect you, right? They'll say, hey, looks like you could participate in this clinical trial. Here's the information, give them a call. And of course, start some fundraising teams, right? Which you can do also as a group, an organization, a business. We have many opportunities. Walk to End Alzheimer's is the biggest fundraising event for us, but we have a bunch of other opportunities as well. Some of our folks just participating in the LA Marathon, and that was their fundraiser. So there's all sorts of, galas and events that you can participate and help us do that fundraising so that we can fund that worldwide research and the programs and services that we provide for free. Again, we have a lot of resources, our helpline, our website, alz.org, our website that has educational classes, information on caregiving, lots and lots of information. So if you want to make a difference today, again, we're always looking for volunteers, folks who can help us meet our goals of awareness, education, programs and support, advocacy, all of those. There's always room for volunteers in the various pillars and work that we do. And our Walk to End Alzheimer's, our walks are coming up in the fall, typically September through November, and we have them all over the county. Actually, our area that we cover in Bakersfield and all the way out in other parts of in the Inland Empire, things like that here in LA. And then in June, the summer solstice, we have our longest day fundraiser. And that is more a hands-on, type of event where individuals decide how they want to do the fundraising. So there's a lot of bake sales. There's a lot of, at the gyms, a yoga teacher will have a lesson and you don't make a donation. My colleague loves, she does an ice cream truck, right? Where she finds somebody to fund the event and then people can just make a donation for a popsicle. So there's all kinds of really fun ways that you can help us fundraise as well. We leave it up to you to come up with the great ideas. And that is it. I can take questions. Let me stop sharing here. Did it stop sharing? No, right?
Not
Maybe
yet.
it did. Oh, I did. Okay, perfect. Last time I couldn't stop sharing my screen for some reason. So so I can take any questions that you may have.
Linda, thank you so much. It was a great presentation. A comment before my question, as somebody who shares caregiving responsibilities for somebody with Alzheimer's, the education part of what you talked about, to me, is so important. This is not something you can figure out on your own because the symptoms of the disease are ever evolving. And we've seen that with my father-in-law and kind of the stages that he's gone through, from confused and angry to anxious to docile back to angry. Um, so what I was hoping that you could tell us today are, from a caregiving perspective, maybe some do's and don'ts that allow the person with the disease to remain comfortable and try to ease some of the anxiety that comes along with the disease.
Yeah, and if Raymond wants this, I can also email this to him since I have his contact info. But we do have a little, we call it compassionate communication do's and don'ts sheet. One of the things that becomes very hard for caregivers is, how do we communicate with them now that they have this disease, right? We're so used to communicating in a certain way, right? We don't lie to people, right? We try to rationalize them. We try to explain things, right? We tell them once or twice and we expect them to understand what we're saying or asking them to do. And when somebody has this diagnosis, all of those things stop working, right? And when we insist on them, then what we create is more of like kind of like a aggressive, hostile environment, right? Because then we say, well, don't you remember I told you already, right? It's the fifth time I tell you. But then no, they don't remember it, which is why they're asking again, right? But we get so impatient sometimes, right? Because, geez, how many more times do I have to say it, right? Because again, we're not used to communicating that way, right? Or they'll say, they'll say something and it's not true or it didn't happen that way, but that's how they remember it. And we try to, correct them, right? But then they get upset, and rightly so, because in their brain, now that it's being impacted by this disease, that's how they remember things. That's how they experience things, whatever situation or activity or memory that they have. And it may not be correct, right? It's sort of like, no, never went to Hawaii. You've never been there. But for whatever reason, they think they did, right? But how do you convince somebody that that's not true, but they believe it, right? And so then you get into this, bickering back and forth, trying to correct them. Again, it's not going to work. Why? Because they have a disease that doesn't allow them to remember certain things or to process information in a certain way that they used to before. And so it's really important to just remember that they do have this disease that is not going to allow them to do or say or remember things that they used to do. They used to remember how to do that they could do on their own, right? And to us seems very simple, like you need to take a shower. How hard is that? How hard is it to remember to brush your teeth? Well, we need to remember we learned those things. We weren't born knowing how to do all these things. And so the part of the brain that has that memory, that ability, that skill is no longer there. And so they just simply can't do it anymore. And so, as Steve, as you said, there's so many emotions that come with this disease, right? It could be very angry. Why did this happen to me? Why can't I do this? Right? They don't understand what's happening. And so it is really important for caregivers, for family members to learn about the disease so that they understand where their loved one is coming from a little, even if it's just a little bit, and learn how to change their communication style, their behavior, how they process information in situations so that they can act and respond appropriately. And so that's a lot of the classes that we do, provide for caregivers. So those are all free, and again, they're all available to them. So I would suggest to take advantage of those.
Excellent. Thank you very much. Do we have any other questions for Linda? Well, I have one more. Um,
Sure.
are there are there warning signs that you can look out for early, either in yourself or in a loved one, where you say, okay, this is a little different behavior. This is something that maybe I should look into.
Are things that we have a whole class called the 10 warning signs that I can present or that you can take on our website that addresses some of these things. So with Alzheimer's, specifically, it is that short-term memory loss. It's sort of that, they've told me the same story, 3 times in the last 30 minutes that I've been with them, right? Or they ask the same question over and over, or I've told them the same thing over and over, right? Well, it's because one of the first signs of Alzheimer's is that short-term memory loss. Part of the brain that retains that information that you just learned 10 minutes ago, even a couple of hours ago, didn't stick, right? That part of the brain is no longer working like it used to. So that information sort of came in and out and it didn't retain it. And so when they ask for the fifth time the same thing, it's sort of to us, it's sort of like that, what's going on, right? That should be a red flag. It could be due to a type of dementia or something else. We don't know, but that's when we say, hey, something's not right. We need to go to the doctor to figure it out, right? Also, sometimes with other types of dementia, there's a shift in their personality, right? And it's sort of like, that's when we hear family members, it's like, they're not themselves anymore, right? They used to be so outgoing, love to participate, go to the senior center. They had their friends, they would go out, and now, not so much. What's going on, right? Again, it could be due to maybe, frontotemporal dementia. Could be something else. We don't know. But again, we need to, those little red flags of like, they used to be like this, or they used to be able to do this, but not anymore. Those changes for that individual should be enough for us to say, there's something going on. We need to go check into that.
Excellent. Linda, again, thank you so much for your time today. We really appreciate it. Safe travels out to Calabasas,
Thank you so
and
much.
we
And
hope to
yeah,
speak to you again soon.
have a great rest of your meeting, your day. And again, I'm gonna before I leave, I'll put my contact info in the chat. Raymond has my contact info as well, so please feel free to reach out in case anything comes up. You want me to present for another group or anything like that, or you need some support, I'm more than happy to provide that for you as well.
Fantastic. Thanks very much. Enjoy the rest of your day.
Thank you.
All right. Okay, folks, let's move on into the Action 360 portion of our meeting. Raymond, any update on the food drive?
Well, on March 26th, 29 Palms is going to be a luncheon honoring it's the Service Member of the Quarter and Non-Commissioned Officer of the Quarter awards, and also they're going to be honoring the Satellite Rotary Club Military Family Support as well as the Holy Name of Mary for the food drive. I have already sent the guest list, but if anybody else wants to go, then let me know by the end of business today. I probably can work that out. So it's out in Joshua Tree at Copper Mountain Community College and 11:30 to 1:30. The commanding general of the base delivers the award, and also Vice Admiral William French, who's the CEO of the Armed Services YMCA, will be present also. So that's the only
Fantastic.
thing we have. And then don't forget to share Riley with everyone too, Steve. I think that's kind of cool.
Oh, yeah, for those of you who weren't here last week, Rotary Youth Leadership Academy is this Friday. And we budget for 2 students each year. We had 3 alternates this year, and fortunately for us, unfortunately for some other clubs who weren't able to find students in their own area, all both our students and all three alternates are now going to attend. We attended an orientation on Monday evening, and then I did an orientation for the one student who couldn't attend last night. So we've got them all set up. Trying to communicate with the kids is difficult for us because they all have busd.school emails, and my emails to them get blocked, which I completely understand and respect, but it makes it a little harder for me to tell them where they need to be for their buses. Fortunately, Sean Casey has been a great help in conveying the messages that need to be conveyed. So yeah, things are looking good. They're taking off. Weather looks like it's going to be great for them, as opposed to a few times in the last few years. So it should be a great trip.
Now, Steve, was your briefing as intense as Regatta's?
It was not. I did not do a scared straight version of the orientation. I tried to make it a little more enjoyable. Um, so yeah, a little different tenor for sure. All right, let's go ahead and move into the calendar. And I know one of the things that has been recently added to the calendar is district assembly.
Yeah, the 11th there. District Assembly should be here. I know I added it. There it
You
is.
added it. It's right there. District assembly will be held in Anaheim this year. If anybody is interested in attending, please let us know. We did budget for, I think, 2 participants. I'm going to try to go. I just won't know until next week, trying to figure out office coverage here. But again, if anybody else would like to go, please reach out and we can work that out.
And it's down in Anaheim this year, so it's not a drive up the hill. Although
Right.
Anaheim on a Friday is going to be a little bit of a slog.
Yeah. Yep.
So other than
Uh,
that, you
Go
want
ahead.
to go
No,
through
go
the
right ahead.
so so the next meeting, our next regular meeting is on April 2nd, Hardwired for Peace. And then April 16th, we have May 7th and the 21st. We have meetings all the way out through this year. That's it for your Rotary year. The calendar has been put together for next Rotary year. So if you have any ideas for speakers, as you can see, nobody's penciled in right now, beginning in July. So I need ideas, maybe leads on speakers would be very helpful. That's the
Excellent.
count.
Thank you very much, Raymond. Okay, folks, that is it for our meeting today. Have a great rest of the week, and we will see you in 2 weeks, I believe. Bye bye.